Hello and welcome. I'm Dr. George Lundberg, editor-at-large for MedPage Today, and we are in Chicago at the meeting of the American Heart Association having conversations with leaders in that field. And today we have Dr. Donald Lloyd-Jones of Northwestern University, where he is Associate Professor of Preventive Medicine and Chair of that department. So thank you very much for being with us.
Pleasure to be with you.
Congratulations on the award that you received yesterday.
Thank you very much.
And I want you to tell our readers about the strategic planning process that you've recently headed up that is resulting in a product named, I doubt that you named it, but named by somebody, 2020. How did that process work?
Sure. So let me take you back in time just a little bit.
Sure.
Beginning in 1999, the American Heart Association, being a very forward-looking organization, defined for itself goals that it wanted to achieve by the year 2010.
Okay.
And those goals were largely focused on reducing fatality from cardiovascular disease through a number of programs that were then implemented. But they were also focused on treatment of existing risk factors, so improvements of control of hypertension, cholesterol levels, diabetes, and so on. Okay. Happily, the AHA actually achieved almost all of its 2010 goals in the year 2008.
How many were there?
There were there was one overarching goal, which was to reduce deaths due to cardiovascular disease and stroke by 25%.
And that was achieved.
And that was achieved 2 years early.
And I'm sure the AHA is happy to take credit for the whole thing.
They certainly are, and frankly, I think they deserve a lot of credit. Not
I think
all
that's
of the
great.
credit, but
that wasn't only jest; it was also sincere. You know?
Exactly.
I think that's great. Many other 2010 goals that have been set for other things have not been met from a health standpoint, but it's nice to hear that that one was.
Absolutely right, and I think. Again, to its credit, beginning in about 2007, AHA realized that they wanted to do that process again for the next decade, the current decade now.
How'd you get the job?
So it turns out that the person who's the head of the statistics committee for the AHA is the person who leads the definition of the strategic impact goals for the next decade.
Okay.
So that's how I got that job. But I have to say that the vision for the 2020 goals really grew out of a process, but I think particularly one person deserves credit, and that's Dan Jones, who was president of the AHA at the time.
Okay.
And he charged our committee with a specific task, which was to grow AHA and almost pivot the organization to build on that really solid infrastructure at reducing morbidity and mortality from cardiovascular disease, and now a new focus at promoting cardiovascular health.
Okay.
So our charge was to, first of all, define what is cardiovascular health, and figure out a way that we could monitor it and measure it in the population over time, so that AHA could target, again, new programs that will actually promote cardiovascular health in addition to reducing morbidity and mortality.
You'd have solid baseline data for 2010.
Correct.
And would it be able to follow the same data sets to 2020 pretty consistently?
Exactly. So, and those data sets obviously need to be both nationally representative, but also allow us to drill down on specific segments of the population, such as men versus women, underserved minorities, and so on.
But in the big picture now, there's got to be something that hooks to 2020, and what are those numbers?
So we did define this new concept of cardiovascular health, and really tried to flip the conversation away from risk factors to now talking about health factors. Okay. So we defined 7 key elements that are health factors and health behaviors that are the core.
And wasn't there some other name on that I heard yesterday? Life Simple 7 or something like that?
Exactly. So the branding on that has now become Life Simple 7.
Life Simple 7. And what are they?
They are, in no particular order, but we'll talk about the health behaviors first. Maintaining a lean body mass index, a healthy weight.
Right.
Not smoking, or if you're a smoker, quitting. Yep. Participating in physical activity at goal levels as recommended by the government. And eating and pursuing a healthy diet, which is really patterned after the DASH diet. Lots of fruits and vegetables, low sodium, low intake of sugar-sweetened beverages and other types of sweets, lots of whole grains, that sort of a pattern. In addition to that, it is also important to know and control one's cholesterol numbers, one's blood pressure, and one's fasting blood glucose. Okay. And so having ideal levels of all 7 of those, we call ideal cardiovascular health. Right. But of course there's a spectrum, and it turns out very few people are perfect on all 7, but we want everyone to be able to...
I think I saw your number yesterday, less than 1%?
Less than 1%.
That's very few, you're right.
It's very few.
Isn't that shocking? I found that shocking.
It is shocking, and unfortunately, we do better and worse on some of the metrics. The thing that really drives that number down to such low levels is the American diet is atrocious.
It is indeed.
Yes.
It tastes good now and then.
Now and then, but unfortunately,
it's not,
healthy it is not, exactly.
So that's going to be a large part of it, the
Yes.
diet part.
Yeah, and as we said, this really requires AHA to change and pivot in terms of its armamentarium and the programs that will be required.
Yeah.
We're going to have to teach physicians how to do one-on-one motivational interviewing and counseling for their patients to change behavior at the individual level, as well as really get organized in our advocacy and policy so that we can change the environment and help people make healthy choices.
Okay, this is a tremendous challenge, a tremendous opportunity. What are the goals for 2020?
The goals are, looking at this composite metric, is to improve the cardiovascular health of all Americans by 20% in the next decade, which is what we like to call a stretch goal. It's a big challenge.
Yeah, but so was your challenge for 2010, a really big challenge, and you met it.
True. True. And in addition, we're looking for another 20% reduction in cardiovascular disease and stroke mortality in this decade.
That's for the United States?
Correct. Yeah.
Okay. Okay. Well then, if you're going to be working with physicians, is there anything specific you want to tell our physician audience right now? What should they be looking for from the AHA?
Mm-hmm. Well, I think you mentioned Life Simple 7.
Right.
And the first step, I think, that's really helpful for physicians so that they learn it and then can tell their patients about it, is to go onto the website. The URL is, you can go to, there are a number of different ways to get there, but it's called My Life Check. So if you go to www.americanheart.org/mylifecheck, you'll see the website for Life's Simple 7. You take a very brief quiz and you get a score that puts you in the range 0 to 10 of your cardiovascular health. And
physicians should do that first for themselves.
Absolutely.
And then for their family, and then start living it for their patients.
Exactly, and you can link then to Twitter or to Facebook, send it to all your contacts. But what it does is it not only tells you where you are, it gives you links to educational content and actual ways to intervene for yourself and your patients to improve that cardiovascular health score.
If you go to Google or Yahoo or Bing and you put in Life Simple 7, what do you get?
You'll get it.
That's even easier than remembering a specific URL.
Yeah, Life Simple 7 or My Life Check will get you there.
Okay, thank you, Dr. Donald Lloyd-Jones from Northwestern University, who's been with us talking about a very ambitious plan that the American Heart Association has launched into, and there's some evidence that it might actually be able to do it. So thank you for being with us, and thank you for being with us today. I'm Dr. George Lundberg at large for MedPage Today.